My name is Muntemba Charles. I'm the Senior Medical Superintendent of Adult Hospital. My role officially as a profession, I'm a nephrologist. So I specialize in kidney diseases. Yeah, and I'm a physician also. And I've been the Senior Medical Superintendent since last year. I'm also assisted by somebody who is called Head Clinical Care, who directly deals with patients and doctors. For example, health workforce. We are below 40% of the workforce that we need. Yeah, access to essential health care. It's a challenge. First and foremost, if you look at it, this is the biggest hospital. But the people that come to here come from very, very far. So even access of transport to reach where you can get specialized care is a challenge. And even access to, for example, some of the conditions can be preventable if they are diagnosed early by competent doctors. So the system of coordinating between us who are specialized, who are in a little bit more, who have more capacity as the biggest hospital, to a clinic in the remotest part of Zambia, where the cases can easily be prevented. There are some challenges because coordination and transportation and information gathering, like we end up having what is called crash landers. Most of the conditions that may come here from those areas come at the time that intervention with that window of opportunity is lost. So what we have is an internal brain drain. We have non-governmental organizations that are taking over the doctors that are from government institutions, and in most cases of those doctors that are taken out, they are not working in clinical work. They are doing more administrative and research like that, yeah. So a lot of doctors are being trained, but not leaving the country like in the past, where they go to South Africa, Botswana, where they are paid better. But they are working within here. But what they are working is not contribute towards the clinical work, where there's a lot of shortages. They are doing administrative work and other work that are not necessarily directly or indirectly related to clinical work. So here, as a government institution, we would like to have more doctors, surgeons, especially pediatric surgeons, physicians, like that. Those are the ones that we need here to manage the cases that we need. But unfortunately, more doctors, because of the non-government organization, are able to pay more and give much more career progression, internal career progression. They're attracting much more of our doctors as they're completing their internship and everything like that, yeah. So there's internal more brain, yes. So we're concerned very much internally than externally. First and foremost, I would like to modernize the hospital, first and foremost, to make an electronic record system so that we can actually get real-time data on the activities of the hospital. Also, I would like to improve the funding of the hospital, yes. I would like to improve the insurance coverage of the patient, yes, like that, yes. Those are smaller things like that. Then the other thing that I would like is the use of research. There's very little support in terms of research, yeah, so that the hospitals here and the doctors working here were able to make evidence-based decision using our local capacity to guide us on how we're going to manage our patients. Yeah, surgical cases, especially children, were not given attention as much as we would like, yes. And during the pandemic of COVID, we had to actually downgrade surgical intervention, especially in children and others, to accommodate COVID, yeah, because almost half of the hospital was closed off to accommodate COVID patients, yes. And as a consequence of that, now we have a backlog of surgery that we term to be non-emergency, but because it stayed away for a period of time, now they're coming as emergencies. Financing, that's a major problem, yeah, yes, financing, yes, and that financing to be accountable, yes, the issue of accountability. The challenge that we have also is this way. Once we have good financing, we buy like equipment, and we have people that are able to maintain those equipment, and we have spare parts for those equipment in case they break down. We have challenges of those people, technical people, to help us identify when the machines breaks down. We have the spare parts in real time to service those machines and make sure the machines are sustainable and used to long use. We have challenges like that, yeah. So sometimes we have the donor community, they bring equipment that we not necessarily need without equipment, backup equipment, yeah. So that's some of the challenges there. Somebody asks for funding and we are dependent on what the external funders wants. Yes, now once we can be given the capacity to apply for grants as a hospital, then we're able to express what we need in the hospital. You see, for people on the ground. Yeah, in most cases, the donors have their own priority according to their statistics. And not every time that is consistency with our priority. Now what we are asking is that if it's possible that we can actually reach the donors as we initiate the request and see if there'll be coordination and cooperation with the donor community. We know they have goodwill from the donor community, but they should also prioritize and factor in the challenges that we are facing. Yes.